Thank you for joining us for this look at the best original reporting from KPBS News this week. I'm Maya Trabulsi. Coming up in this newscast, Mayor Todd Gloria gives his State of the City speech amid another year weighed down by the pandemic. A trash emergency in Chula Vista as sanitation workers enter their fourth week on strike. And rise of the robo-trucks. See how technology here in San Diego is a big part of the move to driverless big rigs. San Diego is seeing some of its highest numbers of coronavirus cases. On average, about 14,000 new cases each day, well surpassing previous records during the pandemic. KPBS health reporter Matt Hoffman looks at the strain on our hospitals and the push to debunk misinformation that's still out there.
The hospitals are trying their best, but when the community isn't responding, that's really tough. It's really tough on the healthcare workers.
Scripps Health Chief Medical Officer Dr. Ghazala Sharif says as of Tuesday, their hospitals have 312 COVID positive patients. Now, compared to this time last year, Scripps had more than 500, but numbers are continuing to increase, and it's unclear when things could slow down.
Last time we peaked on January 8th, that was when all the restrictions were in place. We don't have that right now. So right now we're climbing on the hospitalizations, and everybody's still out doing the social activities, not distancing, not wearing their mask. And so it's so highly infectious, twice as infectious as Delta. And so this may just keep going for a while unless we really just pull back a little.
There are nearly 1,100 San Diegans hospitalized countywide with the virus. That's compared to nearly 1,800 this time last year.
Our, numbers are now only second to the surge that we had back in early 2021.
Sharp Healthcare Chief Operating Officer Brett McLean says his modeling shows a potential hospitalization peak in about 10 days.
But, I heard someone say once, all models are great, but none of them are correct.
Even though hospitalizations are not as high as they were a year ago, this surge is particularly difficult because hundreds of healthcare workers are out with COVID. To help relieve some of that, the state recently issued guidance allowing staff who have tested positive and are asymptomatic to return to work right away, something that not everyone agrees with.
We don't support that.
Very disturbed by that announcement that went out, bringing people back on day one. Even if they're asymptomatic, still means that they can infect others.
Healthcare systems are having to cancel and delay some procedures, but both Sharif and McLean hope that the state does not opt to cancel all elective surgeries.
We are managing literally on a day-to-day basis the cases that we can keep going. On the ambulatory side, we're trying to keep those going so we don't delay care. We had a patient last surge who was the only sole driver in the household. He was delayed for his cataract surgery. And, that really limits people. So we don't want to cut back on that if we have to.
Sharif says 80% of the Scripps patients are unvaccinated, and no one who has gotten their booster shot is currently in the intensive care unit. Matt Hoffman, KPBS News.
It's just not true. It's not true.
Doctors from across San Diego, including the county's own chief medical officer, Dr. Eric McDonald, are still working to correct misinformation that's heard at County Board of Supervisors meetings.
There were a couple of comments made by the public at the board meeting concerning children. The first was that since no child under 10 has died in San Diego from COVID, parents should not get their children vaccinated. I think it's worth saying that no child should die of a vaccine-preventable disease.
Dr. John Bradley with Rady Children's Hospital says some kids are getting severely sick and they are spreading the virus.
To prevent spread in the community so we can finally get this pandemic under control, it's important to immunize kids.
McDonald now estimates that 1 in 20 San Diegans currently have COVID-19.
Transmission in San Diego right now as we speak is the highest it's ever been.
Dr. Christian Ramers with Family Health Centers of San Diego says with so much virus in the community right now, people need to take precautions.
If 5% of people in the county at one time are infectious, you go to a grocery store with 40, 50 people in it, that's a lot of people that are, whether they know it or not, able to spread the disease. So it's just a very, very high risk time at this point.
Raymer shared data from the United Kingdom highlighting why people should consider booster shots,
resulting in basically a vaccine efficacy for the Omicron variant with the 3 doses of about 88%, protecting against hospitalization, whereas just 2 doses is only 52%.
County supervisors declared COVID-19 misinformation a public health crisis last year. There's more information, including fact checks of common misinformation, available on the county's coronavirus website. Matt Hoffman, KPBS News.
KPBS.org is a good place to start for local information on the pandemic. We have case numbers broken down by zip code, testing locations, and all of our reporter content. Just go to our homepage and find Tracking COVID-19 under the News section. As we just heard from Matt, healthcare workers are slammed right now, but they are getting some backup. KPBS military reporter Steve Walsh tells us how the National Guard is helping at testing sites.
Lines have been backing up at test sites around San Diego County.
Either they're getting their test for school, right, or getting their test for work, or just getting their test for sanity's sake. It's such a vulnerable time for us. We don't know if we got just a little cold or we're really transmitting something to our families.
Beginning late last week, Governor Gavin Newsom ordered roughly 200 California National Guard troops to 50 sites around the state. So far, 70 Guard troops have been called up in Southern California, including in San Diego. More are on the way.
We're getting more folks that are wanting to volunteer, so we have slots.
The Guard is estimating that they will be here for at least a month, maybe longer. All of the troops called up are volunteering for duty. Many have served in other missions since the pandemic began. Unlike other missions, most of the troops arriving at test sites are local, so they can at least go home at night. Steve Walsh, KPBS News.
California's military is also helping beyond our state. Kitty Alvarado reports on a special mission to a region decimated by COVID and the work troops are doing to save a hospital from the brink of collapse.
San Juan Regional Medical Center in Farmington, New Mexico, serves a vast area in the Four Corners. Dr. Brad Greenberg, Medical Director of Emergency Preparedness at the hospital, says they care for all people, no matter who they are or where they come from.
We serve a mixture of urban, rural, and frontier areas, and also are a referral center for many of the facilities that exist on the Navajo Nation.
COVID has not been kind to the region. They've had 5 COVID waves, and the last 13 weeks have been especially tough.
We were on the verge of a true clinical catastrophe. We did not have enough personnel to take care of the really incredibly high numbers of critically ill folks.
The Navy came to their rescue. 2 23-member Navy medical response teams from San Diego's Navy Medical Center. Commander Dr. Nakunj Bhatt, the senior medical officer, says they're proud to carry out this mission.
I can't imagine being anywhere else except being on the front lines of patient care.
So I was really, really shocked when I heard that they had so many people that were on the ventilators.
Daniela Jenkins is an ICU nurse with a Navy team. Before the military, she worked at a civilian hospital.
I know how hard it is to be short-staffed. And it has been really amazing to hear these nurses say, hasn't been like this in like a month.
Dr. Greenberg says the Navy's arrival did wonders for the hospital and morale.
Boy, what finally a little bit of a tailwind, some inspiration, and feeling like we're all in this together.
He says they saved the hospital from collapse and many lives in the process.
Any patient that makes it, it almost like heals our soul. And those are the wind that they keep me going.
Not every story ends this way, but Lieutenant Commander Charles Volk, a pulmonary critical care doctor, says losing a patient doesn't mean failure.
Part of our job is, to be there. If we can't cure someone or we can't heal them, is to care for them, at the end of their life and make sure that the end of their life is as good as possible.
Jenkins says success is also measured by those they treat with compassion, even when patients can't feel it.
That time is so special because that is time the patient's not going to remember, but the family does.
These heroes are human, and these experiences leave their mark.
There are times where it's hard. It really is hard, and you just have to step away from it. We're all human. There's times where I've cried.
No, absolutely.
Nurse Jenkins says seeing death is hard, and experiencing loss during the holidays somehow feels different.
It's tough. I mean, walking into a room and seeing a lifeless soul there, it's hard. It's not easy, especially on Christmas Day. That was tough.
But those experiences have changed them for the better too, and they will carry the stories of this community with them forever. Dr. Bott says they learned from those they cared for.
We're very close to Navajo Nation, and hearing some of their stories and their practices and all those things have been very touching for us, and it's been a profound kind of experience.
Dr. Greenberg says they too will live on in the hearts of the staff and community because they answered the call when they needed them the most.
It's our sincerest appreciation for your sacrifices and for your willingness to come out here and help make a difference.
And news of their good work traveled to Mayor Todd Gloria in San Diego.
And from the bottom of my heart, I thank them. They represent the best of this country, the best of our city.
This means a lot to those who served on this mission for over a month through the holidays and New Year.
Honestly, that's all that matters is thank you. It matters a lot. Those two words mean a lot to us.
But as they were leaving, another COVID wave is hitting the rest of the country. That's not lost on Dr. Greenberg.
Well, we're sitting right at the edge of our seats waiting for the Omicron to really make itself known within the state of New Mexico and the region.
As this virus continues to mutate, there are many unknowns. But having heroes like these on the front lines, 1,000 of them who will soon be deployed, brings hope to those communities that are facing or are about to face the worst. Kitty Alvarado, KPBS News.
A reminder for anyone planning to see the Aztecs anytime soon. The men's basketball team put its season on pause this week. They just have too many COVID cases right now to field a team. Saturday's game against New Mexico and Tuesday's game against UNLV will not go on as scheduled. The Aztecs hope to get back on track next weekend against Boise State. COVID-19 and our response as a city will be a major focus for Todd Gloria in the year ahead. Still, the mayor has a lot more on his plate, as he outlined in his latest State of the City speech. John Carroll recaps some of the major points.
Before the mayor said a word, the setting for Wednesday night's speech said a lot. A nearly empty convention center, a reality forced by the fast-spreading Omicron variant.
I wish this year I could deliver this address to you in person with the news that most of our woes were behind us. I am able to report that, yes, we have made a lot of progress.
Gloria's speech focused on a few big issues, among them San Diego's rising crime rate. He pledged to provide police the resources they need, with a focus on treating everyone fairly.
This help should come without excessive use of force, racial profiling, or any abuse by the men and women who are sworn to protect and serve. A great city can fully fund and support its law enforcement officers while also ensuring they honor their oath.
Gloria acknowledged the city's ongoing needs when it comes to infrastructure and pledged to spend the money needed for significant progress in addressing them.
These are core systems that are aging, outdated, often neglected, and in some cases in danger of failing. In 2021, we budgeted nearly $1 billion for critical infrastructure work. That's 4.5 times the amount we put towards infrastructure just a decade ago.
Housing, getting it for people who are on the streets and for those one step away from the street. Gloria says the city is moving aggressively to address both issues.
Housing with services ends homelessness. In 2021, we created 132 units of permanent supportive housing, and we have nearly 1,000 more in the pipeline. In 2021, we issued building permits and entitlements that will create as many as 12,000 new homes, with more than 6,500 in the pipeline right now.
The mayor finished on a note of confidence in San Diego's future.
Amid the darkest of times and under the most difficult circumstances, we have seen a challenge, stepped up, come together, and we triumphed. This says to me that we can and will do it again.
John Carroll, KPBS News.
And here are some of the most read stories this week online at kpbs.org. Fire damaged part of the home of local political leaders Nathan Fletcher and Lorena Gonzalez. Early indication from firefighters is that it was suspicious. The story you just saw from Kitty Alvarado on military hospital relief is getting plenty of views. So is our KPBS Midday Edition segment on the most anticipated restaurant openings for 2022. In Chula Vista, we're approaching a month with the trash piling up in neighborhood after neighborhood. KPBS reporter Alexandra Rangel updates us on the worsening situation and what the city plans to do about it.
Trash cans filled to the brim can be seen street after street in Chula Vista. It's been nearly a month of trash piling up. Tito Mays says it's become a health hazard.
The infestation of all that trash just piled up in one place. You know, we're talking maggots, we're talking animals coming around, and we're talking just the air being polluted in this little space.
He lives in an apartment complex near East Orange Avenue and says he and his neighbors are taking a proactive approach. They're getting tired of seeing their kids play outside right next to an overflowing dump.
And we're going to try to, put our money together, and I'll call my buddies and just have them haul it out and take it, to the landfill.
The building next door is also dealing with the same issues. Rene Dominguez says they've been paying an outside company to haul their trash to the landfill.
Become a health problem for everybody.
This is why City Council member Jill Galvez says a public health emergency has been declared by the city manager. She issued a Twitter statement on Wednesday saying the city would be invoking the self-help clause of their contract with Republic Services. She says city workers have started to pick up overflowing trash at multifamily housing complexes, and a plan for vector control will be put in place. The declaration is expected to be ratified at Tuesday's City Council meeting. Nearly 250 sanitation workers at Republic Services are still on strike. They say they're not going back to work until they get a contract they think is fair. Alexandra Rangel, KPBS News.
We're going to stay in Chula Vista for a KPBS investigation into its aggressive use of surveillance technology. Amita Sharma is looking into the debate between privacy and public safety. She found the city is giving a private company wide control over any data collected by police.
Chula Vista city officials billed the police department's new real-time operations center as a state-of-the-art public safety hub. Privacy advocates say it's a Trojan horse. In late 2020, with no public debate and no competitive bidding, the Chula Vista City Council voted unanimously to approve a contract with Motorola Solutions that, among other things, allows the company to use, copy, analyze, publish, and offer subscription services to any data that passes through its real-time operations center. Those data include live social media feeds, information picked up by the agency's automated license plate readers, and video captured by its drones sent out to 911 calls.
We're talking about a real-time, perpetual history of our lives, our most intimate moments, where we go, who we spend times with, how we socialize. This is seeing who goes to church on Sunday and who goes to Friday prayers at a mosque. This is something that goes far beyond George Orwell's worst nightmares.
Albert Fox Kahn is executive director of the New York-based Surveillance Technology Oversight Project.
This is really just chilling. It feels like handing over Californians, information wholesale to these surveillance vendors, and a real dereliction of duty.
Chula Vista city leaders refused to comment on the contract, but in November, Mayor Mary Salas told KPBS, quote, "There's always a concern at City Hall about trampling on the privacy rights of residents with new technology, and that council members and staff are, quote, ever watchful of it."
On our staff, we have excellent people that really have dedicated their lives to this, and that really are real students of this, and I have faith in their expertise.
Advocates disagree. They are especially alarmed that the city also granted Motorola Solutions permission to sell any data run through its real-time operations center as long as it's anonymized.
I have never seen a contract this bad.
Brian Hofer is executive director of the Oakland-based privacy advocacy group Secure Justice.
If the Chula Vista City Council or administration or procurement folks reviewed this with the lens of protecting their residents' privacy and civil liberties, they completely failed.
Motorola did not respond to an interview request. San Diego ACLU lawyer Mitra Ibadulahi contends the overall contract so lopsidedly favors Motorola Solutions that she wonders whether Chula Vista city officials understood the stakes or were simply outfoxed by the company's high-priced lawyers.
Either they lack the expertise to appropriately analyze and understand these contractual terms, in which case they shouldn't be entering into these contracts at all, or they understand these terms and they're happily trading away the privacy rights of Chula Vista residents.
Foxconn says that privacy loss is Motorola Solutions' financial windfall.
The data broker industry is a multi-billion-dollar industry that is trying to take everything we do, both in digital spaces and physical spaces, and turn it into a product for the highest bidder.
He and other privacy advocates want lawmakers to bar cities like Chula Vista from cutting deals with companies giving them access to data on their residents.
This is something that police departments should be protecting us from, not something that they should be fueling.
From privacy security to national security, tomorrow we'll tell you how Chula Vista police almost exclusively buy their drones from a Chinese manufacturer on a watch list for spying. Amita Sharma, KPBS News.
It's hard to get on a freeway without sharing the road with big rigs. The people at the wheel are a critical piece of our supply chain, and there might be fewer of them in the years ahead. KPBS SciTech reporter Thomas Fudge shows us the robo-trucks being developed right here in San Diego.
This is the mailman that was driving, you can see.
UCSD robotics professor Henrik Christensen points out the computer system in a small vehicle that's been delivering mail at UC San Diego without a driver to guide it. Driverless vehicles like this one are becoming more common, and Christensen says the new technology, coupled with overloaded supply chains and a shortage of truck drivers, are putting driverless trucks in the sights of a lot of companies.
We have this massive need for getting more out of the ports, getting it on the roads. That's where we're seeing these new, so we've seen multiple new companies come up that are actually working on this technology, not only Too Simple, Aurora, GM, Tesla is promising this.
But let's stick with that San Diego startup, Too Simple. Its driverless run last month from a rail yard in Tucson to a distribution center in Phoenix was a first for the company and, they say, a first for the industry. But working with partners like UPS, the company is already delivering goods with its autonomous trucks, provided a human safety driver is present. Pat Dillon is the chief financial officer of Too Simple.
The vision of Too Simple is that from a major freight location, like a port, like a rail yard, like a distribution center, we can take our custom-built trucks that will have no driver in it to take a journey that could be 100 miles or it could be 1,000 miles and go from one freight location to another freight location.
The idea that robo-trucks would be the spear point of self-driving technology makes sense to UCSD professor Christensen. He says driving on highways is the easiest application for self-driving vehicles. And given the choice between trusting a human or trusting a robot at the wheel of a truck, the professor's view is pretty clear.
The drivers get tired from these long hauls, and at the same time, you might not be aware of this, but when you have autonomous driving trucks, they actually save fuel. So even from sort of a green perspective, it makes sense. It's no surprise, really, but if you think about it, computers are actually better drivers than people.
Trucks park side by side at this truck stop in Otay Mesa. Truckers stop here for fuel, a shower, and some rest. Some of these drivers are resigned to the future automation of the trucking industry, but they don't share the view that computers are better drivers than they are. Ron Caplet, who hails from Pennsylvania, says he's been driving a truck for 30 years.
I think it's the way the industry is going to go because of the lack of drivers that we do have in it, but I don't particularly care for it.
Why do you not care for it?
I just think it's going to be unsafe for a while. Not being able to, deal with the traffic conditions, the weather conditions. There's too many variables out here. that maybe a computer won't be able to adjust to the same way. Maybe it will, I don't know, but it just seems like it won't be able to adjust like we can adjust.
About 10 miles away, students working to become registered truck drivers listen to an instructor at the United Truck Driving School in Mission Valley. The school training coordinator is Phil Harris, who says he thinks automation is great. Will it replace all truckers? No way, he says. But it'll change the nature of the job, making it necessary for truck drivers to understand the technology.
You're going to have someone in there as a technician probably. So I can see us being called pilots, navigators, technicians, overseers, whatever. Maybe we won't be called a driver, but that's why we'll always be in that truck.
Driverless technology still needs some attention. Again, here's Pat Dillon of Too Simple.
Things like redundant braking and steering, so that you always have the ability to control the vehicle, even if there is some type of a system degradation.
One student at the United Truck Driving School, Antoine Rackley, says if the job of being a truck driver changes, that's okay with him.
I'm always open to learning, and all new advancement I'm trying to stay on top of. So it's, you either keep up or you get left behind. So if that's the way the world changing, you got to change with it.
Thomas Fudge, KPBS News.
We hope you enjoyed this look at KPBS News this week. I'm Maya Trabulsi. Thanks for joining us.